Welcome to another episode of The Brand Called You, a podcast and podcast show that brings you leadership lessons, knowledge, experience, and wisdom from thousands of successful individuals from around the world. I'm your host, Ashutosh Garg, and today I'm delighted to welcome a very, very accomplished young professional from New York, USA, Mr. Eugenio Zuccarelli. Eugenio, welcome to the show.
Thank you. It's a pleasure to be here.
Thank you. Eugenio is a data science manager. He's been recognized as a Forbes 30 under 30, and he's also working in the task force using analytics to fight COVID-19 and develop policy recommendations for the White House. So, Eugenio, before we start talking about data science and task force, tell me a little bit about your own journey.
So I'm originally from Italy. I've been living there and working and studying for almost 20 years. I did my bachelor there in electronic and software engineering, and I was fascinated by engineering, but I definitely thought that something was missing, and I quickly identified with the fact that it was not having too much of an impact on the people, on people's health. And so I decided to focus specifically on the applications of electronic and software engineering on the human brain, on people's health. And so I studied at Imperial College in London at the intersection of neurosciences and AI and software engineering. And I then decided to work there also for 3 or 4 years at the intersection again of data science and AI. And I became fascinated with the concept of AI, data science, Python. And I've been working especially with a few different industries, but especially with the healthcare sector, with the NHS in the UK for a company that work almost uniquely with the NHS in the UK. So having access to huge amounts of data and a lot of impact. And then I decided to move to Boston for a year, did a master between MIT and Harvard, mostly in the intersection of data science and business. And it's been 3 years that I work as a data science manager at a big healthcare corporation.
Amazing, amazing. So for my viewers and listeners, can you explain the role of a data science manager in the healthcare industry and how it may differ from other industries?
So it usually entails managing a team of data scientists and sometimes also data engineers to obviously be able to develop and complete data science projects or data engineering projects. And it usually entails obviously areas that are focused for doctors, clinicians, sometimes insurance businesses, but everything that's healthcare related. And one of the key areas obviously is that you use the same technologies, you use the same tools that most data scientists use. So Python, R, XGBoost, a lot of machine learning toolkits and so on. You can use also generative AI. The main difference is that the healthcare sector is a very tricky one to work in just because of the level of complexity and the level of impact that you have in the healthcare sector. You're really dealing with people's health. So sometimes there is a bit of a challenge marrying together the test and learn approach of technology, let's fail fast, with the risk aversion of a healthcare business, which obviously cannot afford to test and learn on a person's health. And so being able to marry the two sides of the same coin is sometimes one of the challenges.
Fascinating. And given the fact that you've done so much work in the area of data science, how do you see the role of data science and artificial intelligence evolving in healthcare over the next few years?
I would say that right now we're at that inflection point where we're really starting to see the real effects of AI and data science in the healthcare business. You can imagine that for decades now, hospitals and the healthcare systems across the world have gathered a lot of information. In the NHS, when I was working there, every hospital had a team of coders that would take the doctor's notes, handwritten notes, put them into database entries, and they started developing these databases that are millions of rows, billions of rows. And it's the same in the US. And to some extent, the main issues were about, and still are about, data sharing. How can you safely share data privately and so on? And so now we're starting to see some of those technologies that allow data sharing, data interoperability. And so right now we're seeing, and we will see, and data science leverage even more so, all of this patient information that's going to be more available, and we'll soon be able to also have all of these impacts in the healthcare business.
Very interesting. But given the fact that healthcare is sensitive when it comes to data, how do you address any ethical considerations that may arise, especially when it comes to patient data?
It's a great question. So it usually depends on the applications, of course, but it's a fully fledged process. And I have to be honest, one of the main challenges also is the fact that there is no codified set of processes. There is no single rule that says you should do these different steps to be able to reduce bias, ensure fairness, and so on. Right. So it usually entails looking at the data, making sure that the data acquisition process is to some extent without any bias. It's impossible to have no bias just because we're getting the information that has been collected over the years. And of course, if there is bias in the ways that we collect the data, in our culture and so on, there's obviously going to be biases also in the data. But to some extent, we can use some technologies and some learnings to reduce bias and also to test for fairness, ensuring that fairness and model performance is the same across all of the different subpopulations and so on.
Very interesting. My next question is that in an area which is changing so rapidly with the advancement of technology, how do you ensure that your team stays up to date with the latest developments in healthcare on one side, data science on the other side?
It's impossible. It's something that you have to accept. It's impossible to stay on top of all of the development, obviously in healthcare business, but especially in the AI business. We see every single day a new version of the latest generative AI tool, a new paper. I actually think I was reading the other day that there's a new paper generated every 7 seconds. So we'll have to read a paper every 7 seconds about AI and data science to be able to stay on top of everything. So it's almost impossible. And I would say that it's almost due to the fact that data science and AI is such a broader term. It's almost saying, healthcare cannot be an expert on everything. In healthcare, you have to pick your specialty and be able to learn there. So it's still a work in progress for the whole industry to understand that it's way too much to handle for a single person.
Correct. Well said. And Eugenio, how do you identify and prioritize potential data science projects?
It usually depends, obviously. There are some techniques like the usual Eisenhower matrix, so looking into priority and so urgency and importance. But I would say that my at least personal view is that when you put people in front, people first, then it's much easier to understand the project to pick. So by developing projects that are able to put people first, it's much easier to understand what's the project that has the biggest impact. It might be the largest number of people or the largest improvement in health, and then work from there. And sometimes that's not the case. In real life scenarios, you have maybe data scientists that pick the project that's the most interesting at a technological level. Maybe we can use generative AI and we can learn about it. And it's always important to instead be able to say, let's keep people first. Let's keep the customer, the consumer, the person in front, and let's try to understand what's the project that can have a maximum impact there, and everything else will trickle down.
Very interesting. My next question is that, we just spoke a little bit about the ethical considerations, but given the fact that we are also in handling a lot of very sensitive patient data, how do you ensure data privacy and security of patient data?
Obviously, it depends on the technologies used. There are a lot of privacy-enhanced technologies that can be used. And obviously, some of these are very simple, like anonymization, pseudonymization, and other are a bit more complex. Right now, we as in the AI industry is developing tools, for instance, that use federated learning. So it's all about taking machine learning models and make them move around basically in all of these different locations where data are stored, and have only the models and the parameters move around, but the data stay there. And a great example is hospital systems. You usually have a hospital that doesn't want to share their data, and that's fine. It's understandable. We can instead have a model that moves around from hospital to hospital to be able to provide an impact and a model there. But usually boils down to more of a cultural issue to some extent, because there are technologies that allow privacy enhancing solutions. It's more about the understanding that obviously data sharing has a simple solution, which is let's not share data smoothly. But there is also a trade-off, which is if we don't share data at all, we have no innovation, we have no machine learning, and we cannot do anything that can provide a benefit to the patient. So it starts with understanding this, and then with using technologies to achieve it.
Interesting. So one more question relating to data science, and then we'll talk about your task force experience. What role do you see data science playing in addressing healthcare disparities and promoting health equity?
So data science is a great tool because it can objectively give us the tools to identify biases and discriminations within the data. Sometimes the issue is obviously that we don't have maybe digital data. Sometimes this patient data is on paper, is on systems that are not easy to query. But data science definitely allows us to be able to analyze huge amounts of data and understand some of the disparities, and also understand how we can bridge these gaps. And obviously there's a lot of other ways we can use data science. I think bridging more towards the generative AI area, we also can see a lot of the potential in the more administrative tasks. So we can also use some of these technologies to lower the burden on the clinicians, on the doctors, to deal with all the paperwork.
Amazing. Fantastic. So, Eugenio, let's now talk about your role as a member of the task force, where you're using analytics to fight COVID-19. And this is personally also a lot of interest to me, because I served on the board of Gavi for 8 years in Geneva. So tell me a little bit about the task force and your role.
Yeah, so when I was at MIT studying and doing research, it was between 2019 and 2020. So we obviously faced the COVID-19 crisis, and it was a pretty challenging situation, not just work-wise, but also obviously in terms of like personal relationships. Everybody had to start being locked down. And so we decided, I mean a group of professors, also faculty of MIT and researchers, together with a few other different parties, stakeholders, companies, to form a sort of task force. At the beginning, it was a bit informal, and then it became much more formal going forward, to try and use some of our skills to be able to provide some value. We're locked at home, we're trying to do something, even though we might have not been clinicians or doctors able to be on the front lines. And the idea there was, well, data quality is not great, obviously, especially when you're in a situation of crisis, and data quality is not the priority. The priority is saving lives. But we basically put together some algorithms that would web scrape COVID-19 data online, mostly for the US population. So each state would provide the data on hospitalizations, deaths, and so on across the different zip codes. And we're able to create machine learning models that would predict which areas of the country would have the highest risk of severe hospitalization. So people that would go to a hospital, maybe they would pass away because of the COVID-19 hospitalization. And this is a great way to then provide this as a dashboard, as a map, or just as insights to key stakeholders and decision makers. And that's usually the holy grail of data science. You want to analyze data to gather insights and provide them to decision makers so that they can take better decisions. And that's pretty much what happened. We had a lot of conversations with maybe not too technical stakeholders, policymakers, organizations, institutions, and we identified some of the hotspots that would have been big problems in the future. So some hospitals, some nursing homes, and so on. So really showing the value of data science in healthcare.
And how has the COVID-19 pandemic influenced the role of data science in healthcare, and what lessons can be learned for future public health crises?
It's been a fascinating experience, honestly. I think that there are a lot of lessons, some positive and some less positive. One which I think was pretty fascinating was how everybody started mobilizing, so everybody started to provide some input, some help. And it was great because it was one of those great examples of open source software, open source research, speeding up also the development of research can really help in tackling crises like this. And seeing everybody, across the world trying to help was a fascinating and really, promising situation. But it also had obviously some drawbacks, because when you have way too much information, way too many papers, way too much research, and sometimes with not too much time to do the due diligence, there are a lot of papers that are conflicting with each other. We know very well, some people might say the masks were not working. Some other people might say that the masks were very effective. So a lot of different opinions, and sometimes, and that's also something that we saw there, too much information is as bad as not enough information. So too much information sometimes also provided almost too big of an issue for us to develop something. You didn't know where to go, and you were overwhelmed by conflicting information. But a lot of other areas too.
And when you want to say, look at all this data to be able to predict something that may come, do you think that will also be possible?
Say it again.
A lot of the data that you're collecting based on the pandemic, would you also be able to predict what could possibly be future health crises and how the world may react?
Yeah, definitely. I would say theoretically it's definitely possible. There are some more challenges in practice, but it's definitely possible. Usually in these situations, as I tend to say to my team, it's more of a matter of kind of like culture first. So understanding the value of data, and then finding the right data that can help with these predictions. And only after it's about algorithms and technologies and AI. So as long as we have the right data about all of this information, especially historically, we definitely can achieve something like that.
Wow, fascinating. My next question to you, Eugenio, is how do you balance the need for timely decision-making with the need to ensure accuracy and reliability of the data being used?
It's a great question. It's a challenging one, because it's always a trade-off, obviously. I would say it really depends on the situation. In situations like the healthcare industry, would be a good example of, we want to be a bit more on the safe side. We want to take a bit longer, do the right due diligence, make sure that all of the data is handled correctly, privately, securely, and so on. In other industries and in other applications, there might be less of a need for that, and more of a need and value in doing test and learn, so failing fast, trying things fast, and then seeing how the feedback comes. So it really depends, and obviously it's also a matter on the specific use case. If you can really understand the problem or a specific task, then you can really decide which one of the two areas to go.
I have time for two more questions. My next question is, how can data science be used to address longer-term impact of pandemics, such as economic and social consequences?
Well, once again, we can basically just look at all of the information that we have available historically, learning a lot from the COVID-19 pandemic and previous pandemics, to try and better understand how things pan out following that. It's the issue in terms of having access to this data, obviously recording data in a sort of digital way. It's a relatively recent approach. So beyond probably 20 years ago, people did not have so much of a culture of recording data and entirely understand the value of data. And so we might not have enough information in terms of crisis, pandemics, and so on to make accurate predictions, just because we don't have enough data points.
Right.
But I'm pretty confident that now going forward, with more situations happening, more data being collected, we'll start creating better models that are able to do so. So it's definitely possible. It's more about having enough data to be able to make these recommendations and predictions better.
Amazing. And Eugenio, my last question for you, and this is for the thousands of people, young people who will listen to our conversation. You've had such an amazing journey, studied in Italy, went to London, came to the US, went to MIT and Harvard, Forbes 30 under 30. What would you say are 3 lessons that have helped you to grow so rapidly that you would want to share with our viewers and listeners?
So first of all, that by putting people first, even if you come like me from a technology background, you usually are able to make a lot of impact, and usually impact that matters, right? Everybody wants to see a good story of a person that has a positive impact on society. It's heartwarming. You personally have a great feeling of knowing that what you're doing has a positive effect, and everybody will cheer for you, and everybody will be your supporter because you're doing the right thing and you're doing the thing that helps the world. So starting with people and then working backwards to find the right technologies that help people is usually my mantra, so to say. And you often see a lot of technology people that go down this path because we're so passionate about technologies, because we're so passionate about what we do. Right. They say, what's the cool technology that I want to work on? And then they find the issue that can be solved by that technology. That's usually a bit backwards. So that's one, trying to focus on something that is positive. Number 2 is probably the fact that it's possible to do something that is positive for society, that's got a social impact, but also being a viable sort of business financially, like been working for a lot of companies doing basically technologies that can improve people's health, have a great impact on people's lives, but at the same time also have big financial returns, both for the companies and also for the individuals in terms of savings. So it's a great example of, if we make people healthier, we also can make them richer, so to say, because they spend less money in hospitalizations and so on.
Correct.
And third is probably that it's all about trust, and everything else, data and technology, comes after. It's all about how can we gain the trust of the stakeholders, how can we better understand their needs, and only after using technology, maybe AI or data science, to try and solve those issues.
Wonderful. Eugenio, on that note, and your 3 wonderful lessons, how important it is to put people first. Second, you said do something that is positive for society. You chose health to give back. And the third one you said is all about trust. Thank you so much for speaking to me about your own journey, about all the great work that you've been doing in the world of data science. I've learned many new things from you on the matter of data science. Thank you also for talking to me about the work you did in the task force to fight COVID-19. Thank you for speaking to me, and good luck to you.
It's been a pleasure. Thanks so much.
Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the Brand Called You.